Good evening, good afternoon, and good morning. This is the 1479th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. ASHER Sheikh. Let us begin the session with 1 minute silent prayer. Thank you all. We welcome all to the 1479th day of webinar by Dr. ASHER Sheikh here at International Forum for Promoting Homeopathy. As you all know, the International Forum for Promoting Homeopathy comprises of homeopathy lovers, doctors, and students. And we have 3 sessions every day from 7:30 to 8:30, the Hindi session, 8:30 to 9:30, the international session in English, and 9:30 to 10:30, local language session in Malayalam. Doctors from 65 countries presented various papers here in this forum, and all the papers were brilliant. All the sessions are going in a good way, and we have a wonderful guest tonight in Professor Dr. ASHER Sheikh. Doctor has completed MD in homeopathy and is a professor and National Homeopathic Medical College, Maharashtra, and the director of ASHER Clinics, Nasik, Pune, Mumbai, and Dubai. And Dr. ASHER is MUHS registered homeopathy consultant, professor, and a leading classical homeopathy in India with successful background in diagnosis, treatment, and management of patient illness and diseases. Started practicing homeopathy since 1999, and when the science was considered to be just alternative to some acute diseases. Having an exceptional knowledge of homeopathy principles and procedures, he runs a very successful chain of clinics at Dubai, Nasik, Mumbai, and Pune with all sorts of clinical cases and dealt thereby. And he has more than 25 years of clinical experience in Nasik as the director of ASHER Clinic, which have 12 branches in Mumbai, Pune, Dubai, and Nasik. He is a German New Medicine GNM teacher and mentor at Dubai, Austria, and India. He is a registered university examiner for MUH Maharashtra University of Health Sciences, conducting module of basic learning to German new medicines, that is GNM and GHK. He is the ex-president of Indian Institute of Homeopathic Physician. Seminar on application of GNM and selection of right rubric for treating pathological cases was exemplary brilliant. And he has held position presently as the professor in National Homeopathic Medical College, Nasik. With 25 years of experience as a postgraduate guide of university and MD students, and experiences of taking lectures all over the India and abroad on journey of humans, on how disease happens and how to reverse them completely. And he is the director of Vivedra Resort, the first of its holistic health resort at Trimbakeshwar, Nasik, and is a mentor HF Academy, which is affiliated to Maharashtra University of Health Sciences, and the director of GHK, founder in education, and all these things are there. And as you know, today is we are discussing one of the best subjects, as you know, the relevance of GHK for the modern classical homeopathy. That's what to be discussed, and hope all of you will be have a wonderful session from Dr. ASHER Sheikh. We proudly welcome you to this session. Yes.
Thank you, Dr. Danish. Thank you for that introduction. It is a pleasure being here amongst you all, and I would love to share whatever I can where GHK has been a great tool in helping me solve the most difficult cases and understanding exactly why diseases occur and what are the changes which the body goes through after those cause or ailments are found. So English is fine with everybody, right?
Yes, English.
Yeah. Yes. So it all began when I was trying to practice and give better and better results, but the consistency in the results was little lacking. It's not that homeopathy is not complete, but my knowledge was somewhere less to understand or sit with the patient. And I used to spend hours and hours in taking the history and trying to understand what and how the rubrics have to be taken. The combination of the rubrics were always and always a question for me whether I have taken right rubrics and whether the totality is right or not, whether the eliminating rubric is right or not. And if our eliminating rubric misses out on the remedy, we usually fall into failures. So that made me study German new medicine. I went to Austria, studied under Caroline, and that's where the whole journey and I can say the success completely changed. I understood the man in disease much better, and I could also understand what caused him disease. So just we have a short time, 1 hour. So I'll try to give you as much as I can, just a brief outline. So when we meet later on, we can take cases after cases on different pathologies. So this will be just a gist of what what I'm doing in my clinic and what approach we all have to together try to understand and learn so that these things become very easy for us to treat in our practice. So I'll share my screen. So GHK was like German New Medicine was like a lighthouse for me. When I started learning, it just gave me a proper light. How a light is shown to a ship, so it shows the direction. GNM gave me that exactly. So what did GHK or German New Medicine help me? It helped me understand the cause of every change in our body, what we call as disease. After learning German New Medicine, I hardly call every suffering as a disease. I call it the adaptation, the survival mechanism of the body. And the body is trying to survive because of certain stress or certain changes which the body is going through. And that, if understood properly, you understand the ailments from, which is such a huge chapter in homeopathy. Such a huge chapter. So if you apply ailments from as an elementing rubric, you 100% are there somewhere in that ailments, the remedy is there. You just have to use your materia medica knowledge and you use your materia medica knowledge and differentiate the remedies. And that differentiation is going to be perfectly show us exact remedy which has to be used, because it covers the totality and covers the cause, the ailments from. So what I'm going to do today is I'm going to give you a gist of GHK, how it works and how it is important in classical homeopathy, and going to show you a short case. Gratitude to my friend and mentor, Dr. C.J. Verghese. He is a pillar for us in the Indian GHK journey. So what we understand, imagine a person stabbing with a knife. Okay, the injury is caused. Whether you apply some ointment or whether you apply anything to this or you don't, the injury is going to heal. And you know that injury, you can see the injury healing. But what if that is an emotional injury? An emotional injury is hitting you somewhere. Some type of emotions are affecting the heart. Some type of emotions are affecting the stomach. Some are affecting the kidneys. Some are affecting the lungs. So different conflict has different effect on our body and psyche and affecting that organ accordingly. This is what is going to be understood in today's lecture. So, a shock in your psyche, if is felt by a territorial anger conflict. Territorial anger conflict means anger in your territory, your own domain, your house, your people around you. If you have a lot of anger and vexation towards them, and there is a relapse of anger every time, 100% it's going to cause more effect on your stomach and digestive system. So stomach and digestive system is a part of brainstem, is controlled by the brainstem, and the brainstem is sensitive to these type of conflicts. And that's where you find the pathology developing, or you find the adaptation or the survival mechanism happening. So just to elaborate further, we will go. It can be a verbal emotional injury, which produces lesions and affects the concerned organ. The function of the organ gets altered, either less or excess. In homeopathy, we call it as psychosis shallow or psychosis excess. The function of the organ getting altered. Some cells or some organ, when go into a shock, they proliferate, and some go into cell loss. Just for an example, you find fibroids in the uterus and you find cyst on the ovaries. You cannot find fibroids over the ovaries. So this organ has been programmed in such a way, which is controlled by the brain, and that brain, when goes through that type of shock, or what we call in homeopathy as ailments from, adapts or shows a survival mechanism, and the injury or the effect is seen on the organ, for which we go to doctors, and the doctors, conventional doctors, give on giving medicines, and they hardly help. Ultimately, you land up into long-term medicine unaware what has happened. Nobody tells you to go and find out the ailments from. Kyun ye bimari hua tha? Why this took place? Why there is a problem? Even if you go to a doctor and tell him, I have a breast cancer. Why did the breast cancer happen to me? Why every smoker does not have lung cancer? Some have lung cancer, some don't. They live their full life. They don't never suffer. So this is where we get answers from, is from German New Medicine. So the cause was first affecting the psyche. The psyche gets affected. Then the brain gets affected. And then the effect is seen on the body. So when you are considering to treat that patient, you have to understand the psyche. What had happened? There was ailments from death of loved ones, ailments from being rejected, ailments from being neglected, ailments from death of loved ones, which I told, ailments from being scorned, ailments from indignation, mortification. There are so many ailments from which we need to tap. And those ailments are the guideline for you to find what had happened in the psyche, which had an effect on the brain, the part of the brain, whether the brain stem got affected, the cerebral medulla got affected, or the cortex got affected. And according to that, that brain part which controls that part of the body, that part of the body is going to show either cell proliferation, growth, which we call tumors, or cell loss, which is replenished by new cells in the form of cyst formations. No one can create negative stress within you. You, by virtue of how you process the world, is what you have to see in your practice, or you have to see in the person. For example, this is what we consider in the chapter delusion. Delusion, I am neglected. Delusion, I am used. Delusion, I am forsaken. All these delusions are your own perceptions. How you perceive the world around you are what are the situations which affect your psyche, and then affect the brain, and then affects the organ. So everything starts with your perception and delusions. And that's the reason delusions are the second most important in your totality when you're treating autoimmune cancers and chronic cases. So for example, this case, it is, he came to me on 18-1 with psoriasis. Okay, what question are you going to ask? According to learning GHK, which I'm not going to explain in detail, maybe we will have a different class for it. But the cause here, what German New Medicine says is separation conflict. Psoriasis is to do with epidermis. Okay, so it is the upper layer of the skin is being shed. The story of this person was a cab driver. He was very responsible family man who took care of all the responsibility of the family. He took care of the education of his younger brother, who got a good job. He got a good job in railways. He became an officer in railways. And this guy was still driving a cab. Once his son was not well, it was a medical emergency. At that time, he was driving somewhere out of the city. So he asked his brother for help and to take him to the hospital. But the brother refused. That was very hurtful for him. Since then, he got developed a hatred towards his brother. He was the one who was closest to him, and now he does not want to see his face. So here, the attachment, the skin is all about love, touch, care, affection. It's an organ of love, touch, care, affection. When the psyche got a shock that my love, touch, care, affection, all my life I have made my brother whatever he wanted, I gave him. I stayed hungry and gave him food. And this is what he behaves with me. I don't want to be in touch with him. He lost all his love, touch, care, affection from him. Naturally, the emotions getting dry, the organ also getting dry. The skin started getting flakes and psoriasis. He came to me on 18-1. That's how, if the ailments from is taken, you are sure shot and the results are also very, very, very fast. So he came to me on 18-1 and after around 2 months, that in March, he was completely better. So this fast recovery can happen when you know the exact. So here, the separation conflict was the key for starting the case and understanding the whole story, and the separation conflict was the ailment from. So this is how we go into our practices, knowing exactly what caused it and what was his emotions around this situation. A gangrene, okay? A gangrene, simple. Normally we hear the word gangrene and we get frightened. There's nothing to get frightened about. You need to just know the conflict. The conflict is severe separation conflict, not being able to hold his beloved person. What had happened in this lady's life? The husband was in Navy. He had promised her that he will leave his job and stay with her. But he, after getting married, he did not leave the job. He used to leave her alone and go on and not come for 8 months. She used to miss her a lot, him a lot. And she used to get very angry and resist that situation, that feeling that, oh my God, even after getting married, my husband is not with me and he has deceived me. He has betrayed me. He had told that he will not leave the job, but he has not. And in that, she got diabetes. And in that diabetes, she got this diabetic foot gangrene. She was told to get surgery done around the knee area, but we could save her because we knew the exact conflict. I'll just check the chat. Yes, rubrics, we'll take a case. So many cases, I cannot tell you everything. I'm just teaching you the ailments from. And then in the end, I'll teach you one case where I'll teach you how to take the rubrics. Okay? Or we can have more lectures later on. Okay, this lady, loss of face conflict. Now she got Bell's palsy. Why? Because she was working in a bank. She was a bank manager, and in the bank, the clerk made some mischief. All the blame came on her, and she was about to retire. And she had that fear that if I retire, with all this blame, my pension will not come. So she went home and told her husband, who was already bedridden, that, oh my dear, my pension is on hold because such and such issue happened in the bank. The husband say, we have to say this to our relatives because our relatives will support us with money, otherwise we will starve because they did not have children. That thing, how will I face the world? How will I face the relatives? Got a shock to her on her face, and she got Bell's palsy. She tried everything in this world. It did not help her. The steroids did not help her. The Botox did not help her. She came to us. We made her aware of what was the situation which has made her so sick. And we gave a remedy, taking these ailments from, and she recovered completely. Same is with psoriasis, separation conflict of the scalp, but this is usually intellectual conflict. This is leukoderma, okay, due to certain financial. I hope everybody is with me. I'm going a little fast. Everybody is understanding what I am talking about. Just in the chat box, if you can. All are with me? Yes?
Yes, yes.
I'm just giving you a glimpse of ailments from, and then I'm going to teach you also again how to take the rubrics. So this is called as leukoderma is brutal separation. Due to certain financial difficulties, the corporation gave him a respite from his duties. He began to wonder how he would react to the villagers. He returns to his hometown. They would question him about his employment and means of support, and he would have to respond to each one. They will make fun of me. What are people going to think of me? I'm unable to leave the place or return to my hometown. I felt helpless at that time. This was his situation. Separation from the place and position which he wants to. And that is what caused him leukoderma. Within 2-3 months, the improvement started. Within 6 months, all these spots were almost gone. What we took is ailments from separation, brutal separation. This is not a rubric which you will find in the repertory, but this is the cause. How to convert this into rubric, I will explain. So this is a morsel conflict for all those people who have usually, a surgical case. This is intestinal intussusception. The surgeon had told that immediately, see, here if the dates are there, no, the date was not written, but just one day prior, the doctor said you have to go for an operation because there is intussusception. But when he came to us in the night, we asked him what was the cause. The patient complained about her mother. She reprimands me. He was a child, speaks to me harshly. I'm afraid of her and find it difficult to be with her. So all the intussusception reports are here. And when we gave the remedy, all the bowel lumens, target sign, rights are not seen now, suggested released intussusception. It all got released. See this my cursor, and in the morning the the surgery was cancelled just by understanding the cause, and the cause was morsel. Morsel is your bolus, a handful of food which you put in your mouth is morsel. So something he could not digest. He could not digest the mother being so harsh with him. So these are many cases. Every case gets results. All difficult cases can give results, very fast results, if you know what is the cause. So now to take this ahead, now how did this happen? How did this cure took place? Okay, we will understand that. Any questions you can just put on? Voice is breaking. Now the voice is clear. Is the voice clear? Yes. Okay. Okay. So for getting this This is a conflict running on. Yes, sir. How to understand what is a conflict running on? It's a 1 hour lecture, but I'll try to give you as much as possible, as much as possible. Okay, done. So now we need to understand the basics of our nervous system. Okay, to understand that, we need to understand the basics of our nervous system. Our nervous system, I have made as much as easy possible for you to understand, because this is a basic first lecture of mine. I don't know how many of you are practicing German new medicine, but this is for the new people, new doctors who can join GHK and get wonderful results in their practice. Now, your nervous system is divided into peripheral nervous system and central nervous system. Central nervous system, we all know it's the spinal cord where it goes ahead, but the peripheral nervous system is what we are going to study and what is very important for us to understand in our daily practice. So this peripheral nervous system is having autonomic nervous system. Knowing about is the key to longevity. This autonomic nervous system is what we need to understand. This autonomic nervous system is divided into sympathetic nervous system. Now listen, it's very important. Autonomous nervous system, which is a part of the peripheral nervous system, not the central nervous system, is divided into sympathetic and parasympathetic. Sympathetic and parasympathetic nerve. Sympathetic is daytime. It is daytime when you are active. When you are active and you are full of energy and doing all your work, or in your stress. And parasympathetic nervous system is the night time when you relax, when you are at ease. Okay, this is fine with most of them who are new. Okay, let's go ahead. So in the day, the normal rhythm is a normal human being on the left corner. In the day, you are working and you're stressed. So the sympathetic activity goes up. Night, you sleep and you're fine. Morning, again, you get stressed. You work the whole day. And again, in the night, everything is fine. So just to make you understand. So this is resting and this is active. Again, in the morning, you get active and you work whole day. Your sympathetic nervous system is active, and night, your parasympathetic. So if you work, you rest, you work, you rest, you work, you rest, you are a healthy man. But what happens in disease? This is what happens. So this is what happens in the disease. The normal rhythm, which you see here, the normal rhythm is this sympathetic activity, and night you are sleeping. But suddenly there is a death in the family here. There is a death in the family. When there is a death in the family, the stress takes you up. And you are in high sympathetic activity where it goes on, goes on. You are not able to get rest. You are not able to get sleep. You are continuously in sympathetic activity. Your adrenaline levels are high. Your neurotransmitters are fired. Your histamines level are high. And you're not ready to rest. And the organ which so this is affecting your psyche. This becomes your ailments from. This is what you have to pick up in your practice. What is the sympathetic activity which the patient is going on day in and day and night, and the body is not healing, it is not resting, is what you need to identify. That's the reason you lose your sleep in a high psychic activity, in a stress situation. But when you understand, you give homeopathic remedy, or you become aware, the conflicts, if resolved, the conflict resolved, the healing phase start. That is the healing phase. So we have two healing phase, healing 1 and healing 2. Some healing phase, there is edema. Some healing phase, there is water release or scarification. But this is something called as the epileptide crisis, which I will not explain in this lecture. This will explain you later. So what you need to understand is this normal rhythm getting affected. This is where the ailments from is caught up, and this is where you get conflict active and are in complete stress. And then when you the doctor or the physician, a homeopathic physician, takes the case history, or a GHK understanding doctor tells you that this is causing the disease, you have to start being more aware and not being exposed to this type of stress. You have to find a solution. The healing starts in. So this is how sympathetic reaction day you are working and the stress comes in. Then the sympathetic crisis coming, you land into hospital. But if you go to a homeopath or a physician who knows your cause and the ailments from, and you go into resolution and you rest, you are back to normal. But if it is mostly again and again, more and more stress goes on, then you are going into hanging conflict. Hanging conflict means the stress is, or you feel little better, again that stress is coming in your life. You feel better, again stress coming in. It's called as the hanging conflict. And hanging conflict are the cause of most of the chronic diseases, and that's how you deteriorate and you die. So let's see, understand today, let's elaborate a female reproductive organ case. I will take a case of PCOD, how easy it is to solve polycystic ovarian disease. I selected this topic because this is the most common, and I want you all to be a master of healing polycystic ovarian disease cases. So factors that can lead to infertility are ovarian factor, tubal factor, uterine factor, and ovarian factor. So the ovaries is controlled by the cerebral medulla, and the layer is the mesoderm, and the psyche, when gets affected during the conflict active phase, there is cell loss. This is the ovary, there is a cell loss. And this cell loss develops a healing phase, which we call as the polycystic ovarian disease. These are the cyst formation. If it is a uterus, it is the endoderm and the brainstem which controls it. And the normal reaction during conflict active is cell proliferation. That's the reason I told you in the initial time, it is fibroids here and there are cysts here. So polycystic ovarian disease, understanding in GNM, with the understanding of GNM. Once you understand this, your approach in your clinic will become very, very easy. It will help you ask proper question and the patient will be answering you. You know, not only the patient, if it's a conventional doctor, he will also understand if you learn GNM, because GNM helps us understand the inner changes which the brain and the body are going through, which can be explained very easily to the conventional doctor also. So the doctors also start trusting you once you know GNM. Okay, so we all know polycystic ovarian disease. We will not waste much of time. It is polycystic ovarian disease is a medical condition where woman ovaries produce immature or partially mature eggs. Number over this time becomes cyst in the ovaries. This is a small video. इथे ठेवायचं. बाहेरचं दार उडून जातं. So what are the common signs and symptoms of PCOD? They are irregular menstruation, skipped or absent menses, heavy menstruation, acne, weight gain, hair loss, excessive hair growth on the skin because the testosterone level goes up, the estrogen levels fall because of the cyst, the cell loss from the ovary. Naturally, there is going to be cell loss, so there's going to be less estrogen secretion. Causes of PCOD, which normally they say it is excess insulin, hereditary, low-grade inflammation, excess androgen production. Prevalence is that in last 5 years, polycystic ovarian syndrome cases in India have increased twofolds. In 2014, one of the women had PCOD. Now it has increased to 1 out of 2 women. Lifestyle changes are the main reason, is what they say, the conventional doctors say. But what exactly is the reason? The exact reason is this. This is very important for you to know the process, how to take the ailments from and how to proceed in your case history. So understand, I'm going to read it for you. The biological conflict linked with ovaries is loss conflict. This word is very important. Concerning the loss of loved one. In comparison, the loss conflict related to female germ cell is more of a premial nature. The fear of losing, very important, fear of losing beloved person. Now, my dear doctors, just to make you understand how common it is. Nowadays, the girls at a very early age have boyfriend, girlfriends, or they have a friend who they are in love with. And as soon as they have a fear that that boyfriend has now started seeing other girl, or he's going to leave her, or there are constant self-blame and breakups or death of someone, triggers that conflict in the brain. Okay, so when this is triggered, it causes effect on the psyche and the cerebral medulla, and then the organ which is getting affected is the ovaries, and there is a polycystic ovarian disease which has been diagnosed. Women also suffer loss conflict after miscarriage. Repeated abortions or miscarriage can also cause polycystic ovarian disease. A loss conflict can be activated through arguments, betrayals, or unfaithfulness. What I told, a young girl, if she is being betrayed by a boyfriend, she's going to go into loss conflict. That's the reason nowadays so many young girls have polycystic ovarian disease. The biological conflict linked with ovaries and testes is loss conflict concerning the loss of loved ones. So this is what we have just now understood. Arguments and betrayal is the same slide. So mesoderm, what you need to remember is the mesoderm, the ovarian tissue getting affected, controlled by the cerebral medulla. This cerebral medulla, when goes into a loss conflict, it is affecting the ovarian tissue, which is mostly it is formed by the mesoderm. So the psyche or a shock affects a person, that affects a loss conflict affects a person, a girl, and it affects the cerebral medulla, and then in the ovaries there is cell loss. So my dear friends, what are you going to ask of a case which comes in front of you? Naturally, if a case of polycystic ovarian disease comes, what are you going to ask her? If it's a young girl, you're going to ask of breakups, arguments, or death of some loved one in the family. Same, very easy. Ask this and you get the answer and you get the ailment from. How she adapts to that situation are going to be your later on rubrics. So ailments from and adaptation is what we need to understand, and we have the remedy. I'll give you an example and show you a case how I went through in this case. I hope it is. I hope it's clear for you all. Yashashvi, you need to go through learninggnm.com. Okay, and learninggnm.com, once you understand, there are cases of cases. You also have to join GHK, Global GHK, where every day there is a case being shown to you with proof, with testimonials, with reports before and after, how cures are taking place. So the new mesoderm, organ controlled by the cerebral medulla, there is a loss conflict, the active phase, when the shock is there, there is cell loss and ulceration on the ovaries, and healing phase, the formation of cyst replenishes the ulceration followed by removal of additional cells with bacteria. This is how the body heals, the body responds. We should not intervene, but rather support this. Healing phase, cyst is formed at the site of the necrosis in order to restore the cell loss. That occurs during the conflict active phase. Cyst becomes hard and it is separated from the neighbor in the PCL-B phase, which I showed you, PCL-A and B. Neighboring tissue, it integrates into a hormone-producing function of the ovaries. So once the cyst is gone, the ovaries are restored, normal estrogen functioning comes up, and that brings normal menses. And this is what is precisely the biological purpose of healing for survival of a female. So she goes into shock, she gets injured, the injury is filled up by cyst. The cyst brings in all the required material for bringing in normal tissue growth or cellular growth. And that is cellular growth, if established, the organ which produces estrogen, the ovaries, the functions become normal. The biological purpose of all this thing is for, why does this happen? When additional ovarian tissue tumor produces more extra estrogen, to give, this is very, very important, to give the woman more sexual drive. She should look younger and have better ovulation with the increased chance of becoming pregnant, or increased chance where she can be a good looking female menstruating and can attract males. The loss compensation, but it adds extra tissue in uterus causing endometriosis. The ovaries and the testicles share the same brain relays. Thus, the conflict is same, loss conflict. This is a note. So a male also losing a child gets a shock in his psyche and the testes get affected. So a short case of 18 years. See how it is easy to apply this. Very, very easy to apply this. Just concentrate now. A 18 years female, a student. PCOD diagnosed 2 months back. 1 year back used to get regular flow. But now since 6 months, flow is scanty. And for just 1 day, weight gain, not losing weight even after diet, hair growth above lips, premature graying of hair since 2 years. So I asked, what is your tension? Normally we homeopaths or doctors ask, now what is the tension? So she said, I was in depression since COVID. I was just thinking about my health. It was a phobia. Once I saw news about it, and since then I'm just afraid of it. It was like, even if I go out, I'll be infected. If anyone gets infection, I'm the one who gets most affected. I feel the same as the patient. There were constant negative thoughts about health on YouTube. Also, I watched about it only. Since then, I am having this menstrual issue. Does it fit in our case history? This cause? Yes, please answer in the chat box. So when we ask, as a normal person, yes, Dr. Amit, fear, but yes, fear of losing herself. No, 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 it cannot be. Okay, this is more of anxiety of her health. Yes. So this we learned ovaries, PCOD. This is not the cause, right? This is that anxiety and the fear of the COVID and infection is not the cause. So just to take this ahead, no, it's not about separation conflict. Also, separation is for skin. Here we are dealing with ovaries. That is what I'm trying to tell you. When you deal with that organ, you need to know that conflict. And that conflict is what you need to find in the patient. But that's not the reason for her illness. Her marriage was already fixed. I have an issue with my sister-in-law. She copies me. Then everyone attends her, gives her most of her attention. That used to make me angry. Maybe was jealousy. I used to tell all this to my fiancé, but then he used to argue. I'm going to be the new daughter-in-law in the house and I should get the attention. Why should she get all that attention? This was her stand. So the conflict is, this is happening since a year. Since last year, only I have become irritable. Then I get angry or little things with my fiancé. I will ask him to behave according to what I say. Will shout on him. Cannot tolerate getting the secondary attention. I told my fiancé after marriage, I cannot live with this lady, the co-sister. My fiancé started getting irritated and told that if this is the case, I cannot continue with you further. Now I am afraid, what if he breaks the engagement? I want to get married to him, but this fear is now lingering in him. Here we get our GNM. Now we know that it is ovaries. No, don't come to Dr. Minashi, don't come to conclusions. When in GNM, that's what is so beautiful about GNM. You get the exact cause from the patient himself. Now, if you see in this case, we see that that he is going to break an engagement. Okay, something rings in our brain. When I was reading the cause, the cause said that there is a fear of losing person. Fear. So she went into a fear. I will go back and you can check. See, the fear of losing a beloved person is the cause. This can already trigger the conflict, right? But that's so. Now everybody wants to go, you can go online and check. This is learninggnm.com site. And if you see the biological conflict of the ovaries, this is the fear of losing a beloved person can already trigger the conflict, is what it says. And what is the conflict active phase? In that shock, there is necrosis of the cell and the estrogen producing cells level decreases. That is what causes irregular period, dinar, menarche, amenorrhea, infertility, everything. So what happens is when the restoration happens, the cell come back and more estrogen is produced and the menses become normal. And that is what causes, all that thing causes polycystic ovarian disease. So you can read this literature aram se. Dr. Yashashvi asked me, where is this literature? So this is the literature for you. The cause was fear of rejection. The patient was dictatorial, also jealous about a future co-sister-in-law. She was selfish in wanting a fiancé to live separately for her in-laws because she simply does not want to live with her. And when the partner told her not to continue, she was afraid of being rejected by him. Fear of losing comes in. So how was her adaptation after she had a fear of losing him? What was the adaptation? She was very dictatorial. She was jealous of the co-sister. She was casting away people around her. She did not like her around. She had fear of rejection and she was very selfish. She was thinking only about her. She was not thinking that the son was the only one. Where will the co-sister go if she starts living with her? So these were the rubrics taken, and we had given Platina 203 doses. All homeopaths know this remedy very well. A highly egoistic remedy who cast off people around him. They think that they are like a queen. So this is Platina. This is how they behave. So just to give you a glimpse how a Platina behaves, she feels she's very strong, important, very egoistic, unfeeling, hard-hearted. All are these rubrics. I'm not going to teach you Platina in detail today, but this is what I just wanted you to know and see what happened to her case. She came on 5th for 21 and she got a proper case history. We gave her Platina. We counseled her. We told her this is making her sick. And 22:10, the USG showed normal. Everything was normal. The polycystic ovarian gone. Okay. So this is the approach, beauty of GNM and its approach and how to use homeopathy wonderfully with your by taking, by just learning it, you can reverse anything in this world. Anything. I have cases from what not diseases. I also sometimes don't know the diseases. I have to refer. But learning GNM helps us understand everything. I never use the folliculinum as an intercurrent because you are dot right there with the constitutional remedy and the cause. I hardly use folliculum overinum because once you know the ailments from and the adaptation, your remedy hardly fails. 203 doses. 203 doses. Okay.
Dr. SHAIKH, it's
Yes.
time to we just 5 minutes remaining, and
Okay.
we can have a discussion at least for 1 or 2 minutes.
Yeah. So this was a video of that female telling everything better. And whoa, within 3 months, she was better. And then this is a infertility case again. So it can go on and on. So that's how all about it. So any questions?
Yes. Yes, it's really a very good session indeed. Definitely, we need some more presentations from you so that more and more knowledge will can be acquired to all those attended this session also. Congratulations for your presentation as well as your successful cases with the theories behind using this GNM theory in front. Thank you.
Thank you. Thank you for inviting me and giving me the opportunity. So any more questions?
Yes, I invited Dr. I think CJ Varghese was there. Well, if anyone want to have a question.
Dr. Varghese is there?
Yes,
Yeah, there he is. Yes, he's driving a car.
yes. Yes, now otherwise, Dr. Mbaki. Ehab. Dr. Ehab Maki, you can speak to our doctor. Ehab, Dr. Ehab.
Dr. Ahab,
Yes,
just unmute yourself and speak.
Yes, Dr. CJ.
Yes, thank you, Tanesh, for your offer of an opportunity to talk. I'm very happy that people are slowly getting interested into learning of this great, noble, revolutionary science. It was natural that my colleagues in the profession of homeopathy took it very suspicious, or they were anxious about this new science which few of us brought into this field. It was not brought by ourselves. My very close friend, ASHER, and Dr. Farooq Motiwala, they went ahead of me to Austria to learn this. All of us got the inspiration from late Dr. Vijayakar, and we were fortunate to learn it earlier. And we are trying our best to spread this science. And all of you, those who listen to Dr. Asher's class, are requested to join hands so that this great noble science will reach to the maximum number of people across the globe. So I invite all of you to continue learning. And if you wish to be a member of our global GNM team, where we are having some 3,000 members from 35 countries, you can also join hands with us and let us do this great thing for the benefit of the whole humanity. Thank you, Dhanesh, once more. And congratulations to my close friend, Dr. Asher.
Yes. So global GHK is where you will get exposed to all the mentors, all the senior and all the doctors who are presenting different cases. So there are ample number of lectures. globalghk.com. If you type it down, you will have different lectures, exposure. I could not do it in 1 hour to explain and answer every question which everybody had, but Global GHK has an answer to everything. And every day, every week, new lectures are being added. So you all can be a part of that community, and let's all grow together.
Definitely, we can grow together. And now I invite Dr. Rema Devi Ambadi, madam, to say vote of thanks to the session. Dr. Ambadi. Yes. Ambadi doctor, are you there?
Can you hear me?
Yes.
Doctor, really, see, I don't have words to tell you my gratitude, because I daily I am having a minimum 2-3 PCOD cases. Now I can treat them in a different way, utterly different way. See, thank you a lot, doctor. On behalf of me as well as the IFPH, I convey my gratitude to you. Please come again and again. See, Dr. C.J. Varghese is one of our asset. He is a secret pride for us. And for GNM, he had given me the first food step. Thank you, doctor.
Lovely.
Thank you a lot.
Thank you, Varghese sir. Thank you, Dhanesh sir.
Thank you. Shall I
Pleasure.
interrupt here and tell Remaji that it is not only for PCOD. You tell any disease, there is a real, rational explanation based on the essential faculties. That's mind, brain, and body. With the three,
I know,
with
see,
that
you
only
have
we
given
can
me the
explain it.
instruction,
Thank you.
no? Thank you.
Thank you, Dr. Rema Devi Ambadi, madam, and Dr. C.J. Varghese, and those who attended the session. And really a magnificent day presentation from Dr. Asher Sheikh has happened in this evening. Thank you all for joining the session. Tomorrow we will have a session from Dr. Saptarishi Chowdhury, and Dr. will be discussing about another important subject, that is scope of treatment of DVT to a homeopath and evidence-based approach. With that, thank you all. With that, we come to the end of the day, 1479. It is over to Dr. Mariama John tomorrow.